Hello, everyone. Welcome to my YouTube podcast for medical laboratory science topics for hematology, bacteriology, parasitology, and different subjects concerning the field of medical technology. If you're going to check on my previous videos for educational purposes, it's live because I have plenty of time before filming the video, but now I've decided to record my discussions and make it like a podcast where you listen to it while learning information theoretically. So in this video, I'm going to present my PowerPoint presentation while you listen to my simple discussion that may help you in your review for future examinations, or if you want to explore our field, if you're not a medical technology, then you can watch this video and listen to it. If you want to listen to more discussions, then you can just subscribe on my channel, and it's a bonus for me if you will click the bell for notifications. So let's start. So for today's podcast, we will be dealing with the subject hematology. So what you need to do, you just bring out your headphone, then your phones, and then you listen to this hematology podcast. Our topic for hematology is all about inherited abnormal granulocytic functions such as Job syndrome, lazy leukocyte syndrome, and also those conditions that have a defective in terms of killing microorganism. These are Chediak-Higashi, chronic granulomatous disease, and there are also tests that I've included in my presentation for neutrophil function. So what are the examples of inherited abnormal granulocyte function? Number one for that is the Job syndrome. In Job syndrome, you will hear the words hyperimmunoglobulin E syndrome. This is another term for this type of condition because in Job syndrome, basically what is abnormal, there are high serum levels of immunoglobulin E, hence the name hyperimmunoglobulin E syndrome. And why Job syndrome for this type of condition? Because most findings, there are recurrent skin abscess. That's why they name it as Job syndrome. In Job syndrome, it's a rare immunodeficiency disorder. And what is specific abnormal granulocyte function is associated with this condition, wherein there are random movement of phagocytes. The random movement of phagocytes are normal, but the directional motility is impaired, and the cells, they respond slowly to chemotactic agents. So the main defect for this Job syndrome is the normal chemotactic function. Whenever there is a defect in chemotactic function, it can be a result of abnormalities in the production of chemotactic factors, or there is an abnormality in the inactivation of chemotactic factors, or it can be a result of intrinsic defects of the cellular machinery that is necessary to effect a migratory response. So you remember in Job syndrome, there is random movement of phagocytes that are normal, but their motility, the directional motility towards chemotactic agents, are impaired. What are the most common findings in this type of condition? There can be recurrent skin abscess, again, hence the name Job syndrome. There is pneumonia, associated also with high serum levels of IgE, hence the name hyperimmunoglobulin E syndrome. And also, in this type of condition, what are the clinical manifestations that may be associated? So as you can see here, there can be facial, dental, and skeletal features that are associated with this type of syndrome. So you remember Job syndrome, there is a defect in the normal chemotactic function that affects its migratory response. Another example of inherited abnormal granulocyte function disorder is what we call the lazy leukocyte syndrome. In lazy leukocyte syndrome, in terms of its granulocytic function, both the random and the directional movement of the cells are defective. Unlike in Job syndrome, the random movement of the phagocytes is normal, but the directional motility is defective. But in this case, in the lazy leukocyte syndrome, both of its random and directional movement are defective. And also in this type of condition, the cells fail to respond to inflammatory stimuli, but they have normal phagocytic and bactericidal activity. What you need to remember about this lazy leukocyte syndrome are the following keywords. There is severe neutropenia. When we say neutropenia, there are decreased levels of neutrophils, and there is an abnormal neutrophil motility. So you take note, they are characterized with severe neutropenia that is associated also with abnormal neutrophil motility. And in this type of disorder, they are also characterized by recurrent infections. And if you're going to check on the photos of patients with this type of syndrome, you can associated with stomatitis. They are also associated with gingivitis, otitis, and low-grade fever. So you remember that both of this job and lazy leukocyte syndrome, they are both associated with a defective motility or impaired movement of the phagocytic cells. But in case of job syndrome, the random movements are normal, but the directional motility is impaired. But in the case of lazy leukocyte syndrome, both of the random and directional motility are impaired. And you remember this um, characteristic of lazy leukocyte syndrome, there is severe neutropenia associated with abnormal neutrophil motility, and they are also characterized with recurrent infections and stomatitis, gingivitis, otitis, and low-grade fever. And associated with this type of condition, there are also cases where impairment of white blood cell function is associated with or can affect patients with DM or diabetes mellitus because leukocytes from poorly controlled diabetes, they exhibit aberrant or abnormal chemotaxis. When we say chemotaxis, it's a directed migration of cells in response to some concentration gradients of a soluble chemical attractant or chemotactic factor. So as I am saying, when these leukocytes from poorly controlled diabetes exhibit abnormal chemotaxis, what will happen? There will be an increased susceptibility to bacterial infection, and also it can exhibit leukotriene production and pro-inflammatory cytokine expression. Again, when the leukocytes from poorly controlled diabetes exhibit abnormal chemotaxis, they can also exhibit increased susceptibility to bacterial infection, and also they may have leukotriene production. And lastly, pro-inflammatory cytokine expression. What is this leukotriene we are talking about, or the LPS? These are lipid mediators that plays a role in acute and chronic inflammatory and allergic diseases because they are known to cause or initiate allergic diseases. So this leukotriene associated with diabetes mellitus, they are known to they have become identified with their most powerful roles as villains of the immune system. Why they are considered to be the villains of the immune system? Because they are known to cause or initiate allergic diseases. So this leukotriene production. And another, in case of this diabetes mellitus, aberrant glucose concentration also, or abnormal glucose concentration in diabetes, it also affects the function of the peripheral blood system as well as the immune system, leading to impaired host defense. So there is also impaired wound healing, and it's a serious complication associated with diabetes. Because of this impairment in the leukocyte function, it results to this dysfunctional inflammatory response in the diabetic wound. So again, the impairment in leukocyte function, this will result in dysfunctional inflammatory response in diabetic wounds. So you remember this Job syndrome and that of the lazy leukocyte syndrome. Another topic for this podcast, we have here defective killing of microorganism. Defective in killing microorganism. There are conditions wherein they have difficulty in killing microorganism that invades the immune system. So a good example for that is Chediak-Higashi. Chediak-Higashi. So if you're familiar with Chediak-Higashi, you remember the following keywords: LYST gene, CHS1 gene, albinism, giant or large azurophilic and cytoplasmic granules. What is LYST? It stands for lysosomal trafficking regulator, or LYST gene. Lysosomal trafficking regulator, or that is LYST. And that of the CHS1, it means Chediak-Higashi Syndrome 1 gene. So in Chediak-Higashi anomaly, it's a rare autosomal recessive disease that is characterized by the following: partial oculocutaneous albinism. There is easy bruising in these patients. There can be frequent pyogenic infections. There are also presence of abnormally large granules in the white blood cells or in the leukocytes, and there can be an increased susceptibility to infection. So, what is the main gene that is the cause of this Chediak-Higashi syndrome? The underlying defect is a mutation in the gene CHS1 or the gene LYST. So what is all about this LYST and that of the CHS1, why they are the cause of this Chediak-Higashi syndrome? This gene, they are responsible for the regulation of lysosomal trafficking and the synthesis, the fusion, and the transport of cytoplasmic granule. And in this case, in Chediak-Higashi, if you are going to check for its morphological characteristic under the peripheral blood smear, you may observe for a large blue grayish granules in the neutrophils that may vary in size and color. Not only the neutrophils, but you can also observe this large azurophilic granules in the monocyte, not only in the monocyte and the neutrophil, but we can also observe this under the peripheral blood smear of lymphocyte. And the other one is eosinophils. So those are the white blood cells wherein we can observe for this Chediak-Higashi anomaly with the presence of large azurophilic granules, the monocyte, the neutrophils, and that of the eosinophils. And this Chediak-Higashi anomaly, the large azurophilic granules, they stain positive in stains such as peroxidase or the myeloperoxidase, the Sudan black B, and that of the acid phosphatase stain. And you take note that the presence of abnormally large intracytoplasmic granules, especially in the white blood cells, they are diagnostic for Chediak-Higashi syndrome. And in relation again to that of the CHS1 and that of the LYST, the mutation of the lysosomal trafficking regulator, or the LYST gene, or that of the Chediak-Higashi syndrome, or the CHS1 gene, it disrupts the protein synthesis and affects the storage and secretory functions of the lysosomal granules of the white blood cells and also the azurophilic granules of the neutrophils. And because of this, the defect will result in enlarged vesicles and non-functional lysozymes. So if we're going to check them under the microscope, so these are examples of large azurophilic granules in what specific white blood cell. So you check on what specific type of white blood cell is presented now. So since it is reddish orange in color, the granules present are reddish orange in color in the cytoplasm, and there are two lobes present, so these are eosinophils. So in eosinophils, these large azurophilic granules here are the Chediak-Higashi anomaly. And in Chediak-Higashi, there is also defective phagocytes that do not respond well to chemotactic stimuli because of this mutation of the gene CHS1 and that of the LYST. And another picture will show another large azurophilic granule in the lymphocyte. So this is the lymphocyte, and normally there is no anomaly that can be present in the cytoplasm of the lymphocyte. So this is a large azurophilic granule also, and also surrounding this three-lobe white blood cell. This is a neutrophil, and we can also observe this in the monocyte. So these are the large azurophilic granules that can be seen in the monocyte. And in Chediak-Higashi, there are cases where patients, they have recurrent infections, and they also are associated with enlargement of the liver or hepatosplenomegaly. And aside from that, the patient also may manifest photophobia. And death often occurs because of the so-called accelerated phase with liver enlargement, lymphadenopathy, and pancytopenia, where all blood cells are decreased, and severe recurrent bacterial infections. So that is Chediak-Higashi. So in case of Chediak-Higashi, for the signs and symptoms that you can observe in patients having that type of condition, the skin, the hair, the eyes, they appear lighter than normal, and we call it as albinism. Okay. And then the last one, we have here chronic granulomatous disease. Chronic granulomatous disease. So for the keywords that you may encounter in this type of condition, the keywords are Bridges-Good syndrome. This is other name of chronic granulomatous disease, NADPH oxidase, or the nicotinamide adenine dinucleotide nucleotide phosphate oxidase, sorry. And we have here the ROS. What is ROS? Reactive oxygen species. ROS stands for reactive oxygen species. So what is chronic granulomatous disease? It's a rare disease caused by mutations in any of the five components of NADPH, or the nicotinamide adenine dinucleotide phosphate oxidase in phagocytes. In chronic granulomatous disease, there is a failure of the patient's phagocytic leukocyte to kill a variety of pathogens due to defective NADPH oxidase. And because of this defect, the defective NADPH oxidase, this leads to poor formation of what we call ROS, or the reactive oxygen species. So again, whenever there is defective NADPH oxidase, it will lead to poor formation of what we call reactive oxygen species. So what is the purpose of this ROS, or the reactive oxygen species? These are key molecules in the destruction of microbes. So they are the key molecules for phagocytosis, for the destruction and killing of microorganisms. And in case of chronic granulomatous disease, In person with chronic granulomatous disease, the phagocytosis is impaired. And these phagocytes, they can only engulf microorganisms. They can ingest the microorganism, but they cannot destroy them because of a genetic defect, and that is the NADPH oxidase. Again, when there is defective NADPH oxidase, they cannot produce, they cannot form the ROS. And this ROS, the reactive oxygen species, they are the key molecules for the destruction, for the killing of the microorganism. Without this, without the ROS, the phagocytes can only engulf the microorganisms, but they cannot totally destroy it. They cannot kill the organism because they do lack the enzyme NADPH oxidase. That is very essential for the formation of reactive oxygen species. Okay. And you take note that in chronic granulomatous disease, again, the phagocytes, they only ingest, but they cannot kill what specific type of microorganism. Specifically, the catalase positive organism, like for example, Staphylococcus, because of the lack of appropriate respiratory bursts, because they do lack that ROS. Okay, so that is chronic granulomatous disease. And just a mnemonic for that of the phagocytosis, since we are talking about more on the phagocytic function of these cells, for the process of phagocytosis, what comes first? So you need to remember the mnemonic, Doctor, I don't know. So there are 5 important steps for a phagocyte to finally kill a microorganism that is invading the body or the immune system of the host. So the first one is directional motility. So there is movement. It can be through chemotaxis or it can be through diapedesis. So that is directional motility. And that of the letter R, that phagocytic cell, they need to recognize that microorganism. Is it a foreign to the body? So there is recognition. And that of the I, after the recognition process, there is ingestion. And after ingestion, there is the granulation. And finally, the last step is the destruction process or healing of the microorganisms. So you remember the mnemonic, Doctor, I don't know, 5 important processes for phagocytosis, starting with D, directional motility, that of the R, it needs recognition, that of the I, ingestion, D, the granulation, and finally K, killing of the microorganism. So that is phagocytosis. And then the last topic for this presentation I have are the tests for neutrophil function. So I've listed here the tests for neutrophil function. The following are nitroglytetrazolium reduction test, and also the last two here, Boyden micropore filter, and that of the Reebok skin window. Starting with the nitroblue tetrasodium reduction test. So what is all about this test? So for this type of test for the neutrophil function, you need to remember the keywords nitroblue tetrazolium, chronic granulomatous disease, and the neutrophil function. So as you can see here in the picture, this is the smear, the blood smear that has the nitroblue tetrazolium reduction test. So after adding this reagent, after incubating it, then what will be the appearance of a normal blood smear with this addition of the reagent nitroblue tetrazolium? So what we can observe here, you can observe that the yellow water-soluble dye, it is reduced to insoluble blue dye. So this is the normal result of the nitroblue tetrazolium reduction test. So I'm going to show you another close-up picture for this test. the nitro-blue tetrazolium reduction test. So by the way, what is the importance of this test? It's a screening test for neutrophil function, and it is performed for screening one specific condition, and that is chronic granulomatous disease. So in this test, it will check if the cell in the immune system can change a colorless chemical called nitro-blue tetrazolium to a deep blue color. So which one here is normal and the other one is abnormal? So in this picture, it is the normal. It's the normal um, result for the nitroblue tetrazolium test, wherein in this test, the patient neutrophils, they are exposed to a stimulus and is incubated with nitroblue tetrazolium, and you must observe for the dark granules within the neutrophils. So around the neutrophils, you can observe for the dark granules. So this is the normal result for the nitroblue tetrazolium test. While this picture here, it's abnormal since there is absent or reduced function of the respiratory base with burst, which is in the intracellular process in neutrophils that is dependent upon the enzyme NADPH oxidase, which produces oxygen-free radicals used to kill phagocytized organisms. So in this picture, it doesn't change the color yellow dye to blue color. So only 5% of the neutrophils are stained. Less than 5% of the neutrophils are stained here. But here, 95% of the neutrophils are stained, and it do contain dark granules in the neutrophil. So this one here is the normal result for the nitro-blue tetrazolium reduction test, and the other one here is the abnormal result since it only stains less than 5% of the neutrophil. So again, for the nitroblue tetrazolium reduction test, normally when nitroblue tetrazolium is added, the white blood cell will turn blue. This means that the cells should be able to kill bacteria and protect the person from infections. But if the white blood cell doesn't turn blue and remains with its color yellow dye, then this means that they cannot kill microorganisms. And the other test for neutrophil function, we have the last two, Boyden micropore filter. So what is Boyden micropore filter? In this test, it tests the migration of the normal response to a chemotactic factor. It tests the migration of the normal neutrophil in response to a chemotactic factor. It's for leukocyte chemotaxis. So in other terms, this Boyden micropore filter, the main purpose is for testing the normal leukocyte chemotaxis. And the last one, it's Reebok skin window. It's an in vivo test of the inflammatory response in which the skin is abraded and a slide is applied to the abraded area to permit visualization of leukocyte mobilization. So what is the purpose of this test? It will evaluate the speed, the type, and the number of phagocytes that responds to a skin abrasion. Okay, so that's all for this topic. So I hope you have learned something from this simple discussion. And please don't forget to subscribe, and you can click on the bell for notifications of the upcoming podcast video for another topic in the field of medical technology. Thank you and have a good day.